Well, hello and welcome to everybody today. This is Kyla Newland from Mountain Pacific Quality Health. In our next series of It's Worth a Shot, today we're going to be talking about pneumonia vaccines and some updates from the CDC. Once again, they like to update their pneumonia guidelines fairly frequently. So hopefully I'll be able to help clarify what that looks like. And then we've also got Crystal Morris is going to be presenting on the kindness campaign. So as always, next slide, please. If you have ideas on upcoming topics or things that you'd like us to cover in this series moving forward, please put those in the chat or reach out to any of us or come off mute today if you'd like and make those suggestions, because we're always looking to make the content most useful to our audience. Next slide, please. So as I mentioned, the CDC has recently updated their recommendations for a pneumonia vaccine for adults specifically. And this includes folks 65 and older and also other folks that are at higher risk for pneumonia, including patients that have chronic illnesses and folks that are also immunocompromised. So first of all, just a little bit of history. Pneumococcal disease remains a significant burden among adults, with estimates of 3,000 deaths of invasive pneumonia in folks 19 and older as of 2019, and as many as 100,000 hospitalizations. So it's a significant burden and something that we can really combat with effective vaccination and increasing vaccination rates. Pneumonia can cause what we think of as typical pneumonia in the lungs, but it can also cause meningitis, bacteremia, and also strep pneumoniae, which is the most common cause, which is what we're covering with these vaccines, is a frequent cause of ear infections in kids. So that's why it is also a recommended vaccine, primary vaccine series for kids. So recently we had two new licensed pneumonia vaccines, and that's what's kind of brought about these changes and recommendations. And very useful item that I found is an app for that. So I would encourage everyone, I've got links in my resources to either get this app, or you can also access it via the desktop version. And it's available on the CDC website, will be on my resource slide, and is very helpful in determining which folks need which pneumonia vaccines. Next slide, please. So currently we have 4 available vaccines on the market. The two new vaccines are the PCV15 and the PCV20. These were both approved within the last year and then added to the CDC's recommendations. The typical one that we'll see in pediatric population is the PCV13. And then the one that we've typically used for adults is the PPSV23 or Pneumovax. And there has been changes in the recommendations on adding these conjugate vaccines to the adult vaccine schedule, as we have seen that there might be some additional benefit. Next slide, please. So this is a chart that shows the currently available vaccines, which serotypes they cover. So there are about 90 serotypes of strep pneumoniae that we know of. And so each of these, the numbers correlate with the strains and the number that are covered in these vaccines. The vaccines do include a high percentage of the ones that cause the highest percentage of invasive pneumococcal disease. And as you can see, the 2 new ones are only approved in adults as of this time. So our primary pediatric vaccine remains Prevnar 13. And then Pneumovax is approved in 2 and older, and then the other 2 only in adults 18 and older. Also, you can see what coverage they have for invasive disease. And if you look at the percentage, Prevnar 20 does have 30% coverage. So it's kind of the highest percentage of covering those serotypes. And so that's why it is technically going to be the primary recommended vaccine for adults moving forward as of now. Next slide, please. So here is the list of adults that need to get a pneumonia vaccine. The items with the asterisk are considered immunocompromised folks. And then we add on to that some other folks that we know are at higher risk, like folks with alcoholism. You'll notice diabetes is on this list, so that's going to include a lot of your patients. And then also folks that have chronic heart, liver, or lung disease, and that does include folks with COPD, emphysema, or asthma. So that could be a significant portion of patients as well. Next slide, please. So the CDC has it's actually a 4-page kind of a tool that has the algorithm for when to give which vaccines. And I just pulled kind of the most simple one, which shows folks that have never had a pneumonia vaccine, are adults, and are indicated to get one. And really, they should receive this new conjugate 20 PCV20 vaccine. If they are given the PCV15, they're still needing to get the Pneumovax or PPSV23. The reason for that is there are 5 additional strains that are not covered in the PCV15 that are covered in the 20 and the 23. And so to cover folks for those, if we are giving the 15 first, we do need to follow that up with a dose of the 23. And then there's all sorts of guidance, not only on this slide, but if you look at this full handout, which is included in my resources as well, on folks who are kind of midstream on their pneumonia vaccine already. If they've already received the 23, then you'll notice here it doesn't say that you should administer, it says you may administer. So this is kind of an optional. Do you think your patient is at high risk? Do you think that they'll benefit from getting a conjugate vaccine after they've gotten their polysaccharide vaccine? I'm seeing some questions in the chat. Okay, Lori is saying that the state immunization program has not added, this is in Alaska, the new vaccines yet. And I am not sure about that, but that is something that we can certainly put on our Q&A for next week, Lori. Thank you for that. Okay, I think we can go to the next slide. This is another chart that I pulled from Pharmacist Letter, actually, that kind of simplifies the vaccine recommendations. Once again, if they haven't had the vaccine and they're indicated to get it, they should get Prevnar 20. If they've already gotten one of the conjugate vaccines, they may, as you see, get one of the new conjugate vaccines. And then over here on the right, if they've gotten a conjugate vaccine, you can consider giving them the Pneumovax 23 if they have started their series with the Prevnar 13, which was one of the previous recommendations for this population. Then they should complete their vaccine series with the 23. So they're kind of keeping the old recommendations for folks that are kind of midstream. So this is definitely not simple. And so I do encourage you guys to use the app, and then also the additional chart that I've included that kind of goes through the different situations for folks. Next slide, please. So as far as side effects for pneumonia vaccines, these are pretty typical. About 70% of folks receiving one of these vaccines will have one of these, what we say are mild to moderate side effects. So they are pretty common, and they are more likely to happen if they get other vaccines on the same day. I've heard that from many patients if they get their flu and pneumonia on the same day. But that is totally indicated. These vaccines can be given with pretty much all other vaccines, and that's not an issue. Okay, I see another question here. Okay, so someone's asking about the time frame. So for the new recommendation for the PCV20, it's basically a one and done recommendation. With the folks, and this also, it's a little blurry because the pediatric population still has not been approved for these, so they still have different recommendations, but there are repeat doses for certain folks, like people that don't have a spleen or folks that have cochlear implants. So that's why I encourage you to either use the desktop application to put in the specifics of your patient. I have used it myself. I used it for both of my parents just to kind of test it out, and it was really slick. So I would encourage you to do that, or use one of the flow charts that's included in the CDC resources. Does that answer your question? Okay. Next slide, please. So I also wanted to include, as I was going through looking at the new pneumonia recommendations, there was an updated recommendation for the shingles vaccine as well that I just wanted to mention. So this was fairly recently. The shingles vaccine previously was recommended for those 50 and older, 2 doses given 2 to 6 months apart. And the CDC recently added folks with immunocompromised conditions to this. Those 19 and older are indicated to get the 2-dose Shingrix vaccine series. So just an update. And I've also included in my resources the updated adult vaccine schedule, which includes all the changes that I've talked about. And Lori says in the chat that she has experience with less side effects when these vaccines are given sub-Q instead of IM. So thank you for that. Next slide, please. And here's the list of the resources. A lot of good things here. I had in here a, oh yeah, I guess it is still in here. You Call the Shots web-based training, which is the CDC. They have training for every vaccine. I will just give you a heads up. I went in to do this training to prepare for this presentation, and they have not updated the training for pneumonia vaccine yet. So, but it said it had been updated, but when I went through the training, it had not. So I would look for that in the future because I'm sure they're in process of updating that. And then all these other resources, including the vaccine information sheets, which are those forms that you provide to your patients when you're giving vaccines. Any more additional questions or clarifications that I can help with before we move into Crystal's presentation? And if things come up, feel free, if questions come up, to put them in the chat as we move forward. Thank you, everyone. And I'll turn it over to you, Crystal.
All right, sounds good. Thank you, Kyla. Well, hi, everyone. My name is Crystal Morse, and I am visiting you from Wyoming. So I'm here to talk about a kindness campaign that we started in Wyoming. And it's a campaign shaped to promote the power of human kindness and encourage the uptake of the COVID-19 vaccine. Next slide, please. So I just want to thank our community partners who helped us in this delivering of this project and how successful it's become. It really spawned out of the Wyoming Coalition group. So that's how it became. And I hope that this makes your day. I'm sure that when I show you what the campaign is all about and show you one of the final products, I think that you'll walk away with a smile. I sure did. And again, I want to thank the Wyoming Department of Health. They were a big collaborator with us in this project, as they were also focused on the vaccinations and the uptake of COVID-19 and getting the vaccines. And then as I hopped along and presented this idea, I really should have called it the campaign, the kindness campaign wagon, because it seems like more and more partners got on board with me once I, told them what this was about. And so the University of Wyoming, they are part of our coalition team, and told them what the kindness campaign was all about, and trying to really promote the vaccination and the adversarial anger towards, basically where we were going. And they said, hey, yes, we want on board. And then, of course, I really want to thank our Mountain Pacific family, powerful partners, family advisors. Once I heard them or told them about the campaign, they were one of the first to make one of the videos. So we have 3 patient family advisors who have made a video for us, and I can't thank them enough. So again, these are our partners that join me on this crusade, and I can't thank them enough. So next slide, please. So our objectives were we knew that we had to move fast, and we needed to move far. So we took this from a systems approach. With Wyoming showing one of the lowest vaccination rates in the country, we knew that in order to influence and promote better health outcomes and try to get others through the uptake of the COVID-19 vaccine, we knew that we needed to work as a team. So this campaign took on a whole different front than when we first launched it, and we found it to be that also addressed clinician wellness, and it also helped defeat clinician burnout. So our actions were that all participants in this campaign were volunteers, and no one was paid to participate. We recruited from our community coalitions, and really our drive was to feature best practices, so including why the participants chose to get vaccinated. But we did this in a softer approach. So we avoided words such as mandatory and required. Rather than, we focus the campaign on the gratitude and kindness and taking care of one another. So our mission was to create a culture change, like as I mentioned, within the workforce and the workplace, with unscripted, uplifting, and positive messaging, with active ways to connect with colleagues and peers. So that's something that that's been missing since the pandemic began. And then we use for our data collection was the COVID data tracker from CDC. And then we also looked at NHSN immunization data as well. Next slide, please. So here's our story, and it's really a sad one, and I'm sure you all know it. The campaign it really, as I said, it spawned out of our community coalitions, but also the stakeholders that were involved, who were really reporting in distrust of the government. The cultures in their workplaces were really poor, and the teamwork was, the morale was very low, and people just didn't thrive anymore in their workplaces. And actually, if you've heard of the word presenteeism, which is that you're there, you're just kind of going through the motions, you really could care less. We were seeing a lot of that compassion fatigue. People were trying to be compassionate towards one another, and patience, and it just was a snowballing effect, and we were going downhill very fast. And so we were just seeing a lot of anger towards one another. And so that's kind of the story behind how the campaign started. Next slide, please. So here's an article that came out of McKnight's long-term care. And it talked about, this couldn't come at a better time. We started the campaign in November of last year, and a colleague of mine sent me this article, and basically it was, supporting staff and reducing turnout, and how do you do that? And, there was bonuses and financial benefits that were being thrown to employees for picking up extra shift and working longer and, working so many days straight. And yeah, the money was good, but was it worth it? And so this survey came out of nursing homes that were queried out of Michigan. And it talked about, they interviewed or surveyed CNAs, they surveyed nurses, administrators, and even family members. And interesting enough, the survey that came back were 60% of them were CNAs. And a lot of, I went and pulled this article through PubMed, and basically the comments were, yeah, the money was good, but was it worth it? No. And so just kind of bringing you back to the screen where it says that the even stronger theme across all the respondents was the need for staff to feel appreciated, respected, and listened to. So again, basically the premise of that journal article was the money wasn't worth it. Next slide, next slide, please. So interesting enough, after I, talked about that article in a coalition meeting that I was facilitating, I had a community health that worked here at this community health center of Central Wyoming, good friend of mine, colleague that I had known for a long time. And she said, interesting you bring that up, Crystal, because I had to call the police. And in my 27 years of nursing, I have never seen the healthcare system and the landscape change how it has. And she said it's gotten so bad that our CEO, Carl Harris, who you see on this slide, he had to send a letter out. And here's what it said. So she sent me a copy of that letter, and I, took a small paragraph out of that letter. But Mr. Harris starts out the letter is that we're on the same team. And so, he talks about last year, frontline workers were praised as healthcare heroes. And today, more than ever before, we need your support and we need your patience. We're pleading with you to be kind and considerate. When you enter our facilities and engage with staff, a small percentage of our interactions are resulting in verbal abuse of the very people who are here to serve you in the time of need. So in a very, very nice way, Mr. Harris said in this letter, enough is enough. And we're not going to take this anymore. And you will, we demand respect and we demand kindness. And I thought good for Mr. Harris for advocating for his staff, because those people that were reporting to that sort of behavior and really abuse were my friends and they were my colleagues. And it was hard for me to see them report to that and go through that. Next slide, please. So really, here's what it became out of this campaign. I called up Mr. Harris and I said, Carl, I said, we have, I run a community coalition. I have some of your staff members that are engaged and involved. I heard and I saw this letter you wrote, and I want to offer you participation in this campaign. And so the more I talked about it, he said, you know what? He goes, I'm going to connect you with with our marketing people. But he said, not only is Casper going to participate, all of Wyoming is going to participate. And so they had 4 FQHCs who participated in the kindness campaign. And this is the one that Casper came up with, if you want to play that.
You're probably wondering what this is all about.
I am.
I'm going to tell you here in just a minute.
Okay.
It's you and me, girlfriend.
Is it?
Yeah, yeah.
So Lenore, you're here today because I nominated you for the kindness campaign. Because every time that we have a patient that we call you over to the clinic for Spanish translation, you come over with a smile on your face. And the first thing that I notice about you is you don't just pay attention to what we're doing with my patient. You go to every member in the pod and you tell them hi. You go out front and you tell the reception staff. You can always go out and greet everybody. Not everybody does that. And that's the true heart of somebody that's really kind and really focused on the people that work here and all the things that they do. I'm gonna try not to cry.
Oh my goodness.
I nominated you for the kindness campaign because we don't see this in a lot of people. And we really haven't seen it in a lot of people over the last year with COVID. So I wanted to let you know that I think you're probably the kindest person that we have in the building. I appreciate that. And when you're in appointments with me, you can always make a tough situation better. You always have a smile on your face and you always reach out and you touch people. And you make those appointments that are tough. You lighten and brighten the mood because you're just such a kind, sweet person. And I wanted to thank you for that. And so I nominated you for the kindness campaign.
Oh my goodness. Thank you, Miss Marilyn.
And I will
That is
hug
so
you
sweet.
because you're so
Oh,
sweet.
honey, thank you
And you're
so
so
much.
kind.
That is so sweet
And
and so
I'm
nice of
so
you.
glad that you're here.
Thank you.
You're welcome.
Thank you, honey. I'm so glad to be here. That makes me feel so good. Thank you so much.
All right, well, go ahead and advance that to the next slide. I think that is my final slide, but looking. Looks like it's playing again. Okay, well, Kyla, your face is the only face I can see, but I saw you smiling. So I hope that made your day. Again, we never mentioned the vaccine in there, but you know, Lenore, I don't even know her. I want to hug her myself, but we got the quote from her saying, you know what, I did it because we're all in this together. We need to protect one another. So basically that's the premise behind the campaign, was a softer approach to, you know what, I did it. You can do it too. Join me in this, and let's band together and protect one another. So I just took this from the CDC COVID tracker. I wanted to just kind of give you guys an idea of where we started with this campaign. We started in November, so we were at 43% in November, and our vaccination rates that we believe we helped with this campaign moved up to over 50%. So that is the kindness campaign in a nutshell. Thank you for listening. Thank you for having me. And it's been a fun project. I've loved it every minute of the way. Again, I don't know these people, but we have some really great people out there. We really do. And so thank you for having me. Oh, and then resources. If you want to go to our Mount Pacific webpage, all the kindness videos are posted on there. You can see who's participated, and no one video is alike. And so I really encourage you, if you really need a boost in your day, to go look at those videos. They're really uplifting.
Well, thank you, everyone, and I will close us out. Does anyone have any last comments or questions? Crystal, your kindness campaign is just so awesome. Thank you so much for sharing.
Yeah, thank you for having me. I love talking about it. As you can tell, I'm very passionate, and I love those people.
All right, well, we'll see everyone next week. Thank you so much for your time and stay safe and be well.